the majority of patients who have 2019 nCoV pneumonia. And if we look at a CT scan, these individuals might have ground glass opacities. And these two seem to be bilateral. So these are occurring in a minority of cases. Again, it's mostly the bilateral pulmonary infiltrates we see. We can see unilateral pulmonary infiltrates, but we can also see ground glass opacities on a CT scan. And with the CT scan, you may also see multilobar consolidations. So here is an image showing bilateral or multilobar consolidations here. So classic finding seems to be bilateral pulmonary infiltrates on imaging with regards to this 2019 nCoV. So how do we make the diagnosis, and are there any possible treatments for this virus? So the way we diagnose it is through detecting the viral genome by real-time qPCR. So this is the way we can detect the virus and make an affirmative diagnosis. Once we make the diagnosis, are there any ways we can treat it? Right now, there are no official treatments available. There has been nothing shown through evidence to say this is a treatment that we can use. So right now we are using supportive care. So giving patients fluids, treating any co-infections or any bacterial co-infections with antibiotics, those types of treatments. So it's more supportive at this point. There is one report from Thailand of physicians using oseltamivir. So oseltamivir is an anti-influenza antiviral, and they used oseltamivir in combination with lopinavir and ritonavir. And they seem to have shown, at least in one patient, that the coronavirus was negative within 48 hours. So this is very anecdotal at this point. It's only one patient, but it's a possible step forward with regards to determining a treatment for this virus. So oseltamivir, again, is an antiviral we use for influenza, and lopinavir and ritonavir are both antivirals that we use to treat HIV. So right now, we're in early stages of determining a treatment, but this may be a right step forward. So how do we prevent getting infected with this virus in the first place? So if we feel that we may have been in contact with someone that is sick, or we've touched something that another person might have touched, or hands are dirty, we want to wash hands with soap and water for at least 20 seconds. We could use an alcohol-based sanitizer instead if soap and water are unavailable. We want to avoid close contact with sick patients or dead or living animals. So we want to avoid close contact. Close contact is defined as 2 meters or 6 feet, so a 2 meter or 6 feet radius. We also want to avoid travel to affected areas. So any areas that are having any outbreaks of any virus, we want to try to avoid travel to those areas. If you are sick or are ill, possibly with this virus, you want to avoid going to work or workplaces. You want to avoid infecting others. And important as part of all of this is what we call respiratory hygiene. Respiratory hygiene is where we want to avoid touching our mouth, nose, eyes, face if our hands are not washed. So if we have dirty hands, you want to avoid touching your mouth, nose, eyes, and face unless you have already washed your hands. So this is common with all viruses, all illnesses, but this is important for preventing this virus as well. And there's this question of using a face mask. Right now, WHO doesn't seem to highly recommend a face mask. So right now, the WHO is suggesting that you might not need a face mask if you are asymptomatic, you're around other people that are asymptomatic, and you're not in an area where there is a lot of this virus. So it might just be an unneeded financial cost. So we'll kind of keep an eye out for further information on face masks. And if you or someone else is sick and they're coming back from an area that has this viral outbreak, the Centers for Disease Control in the United States suggest quarantine for 14 days. That is the incubation period for this virus. So this is what we're doing right now. So again, if you're arriving from an area of outbreak and if you are symptomatic or asymptomatic, so they wait to see the incubation period and see if you require quarantine or require treatment. So again, these are the ways to help prevent this new coronavirus. Wash hands with soap and water for at least 20 seconds if your hands are dirty. You can use an alcohol-based sanitizer instead if needed. Avoid close contact with sick individuals. Maintain a approximately 2 meter or 6 feet radius. Avoid travel to affected areas. Avoid school and workplaces if you are sick or ill. And maintain good respiratory hygiene. These methods help prevent all sorts of illnesses, especially respiratory illnesses, not just this new coronavirus. So again, these are methods we can use to help prevent this new coronavirus in